I will present the final results from the ALASCCA trial, which is a randomized controlled trial studying the effect of adjuvant aspirin, low dose, 160 milligram, to patients with colorectal cancer, stage 2 and 3 disease, using a predictive biomarker that is PIK3CA. And the patients we have screened 3,500 patients with colorectal cancer, and of those, around 70% had a PIK3CA mutation. And we had also another arm in the trial studying genetic alteration in the same signal pathway, that is the PI3 kinase pathway, because it might be that it's not only the PIK3CA mutation that is of interest, but also the mutation outside that specific region, but in the same pathway. And that has never been explored before, so that's an explorative arm. But then 3,500 patients were screened, and 70% had the PIK3CA, and almost 90% had the other mutations in the same signal pathway. So altogether, 37% of the patients had any kind of mutation and could go into the trial. And they were then randomized within those two groups between 160 milligram aspirin or placebo once daily for 3 years. And now this summer we finalized the last patient that went into the trial that was been followed for 3 years. And what we see, the primary outcome objective was time to recurrence. And what we could see in the PIK3CA arm, and what we could see is that the primary outcome objective was met, actually. So it's a positive study showing almost or more than 50% reduction in recurrence in patients being on aspirin compared to placebo. And what is also interesting is that in the explorative arm, with the mutations in the same signal pathway but outside the PIK3CA hot mutation regions, we saw an as good effect and even a stronger effect, a 58% reduction of recurrences. So meaning that we can expand the targeted population for this treatment. It was also seen there was an effect on disease-free survival, and also, of course, it is not designed for subgroup analysis. The power is not enough, but we could see that all results were pointing in the same direction. So no matter if you had which mutation you had, or if you had a colon or rectal cancer, or if it was a stage 2 or 3 disease, or if you had neoadjuvant or adjuvant treatment, they all had effect, and also both in male and females, and even actually a stronger effect in females, which needs further scientific evaluation.